everybody, and thanks for coming. Thanks for Hoyes for inviting me to do this. Again, I think it's something that a lot of people are aware of, like John's just been saying, and not always something that's evident, and we'll talk through the various things with gastric ulcers. It is a relatively recent diagnosis, I suppose, because of the technology that's now available that wasn't around a few years ago, and that's basically a 3-meter long endoscope to look inside a horse's stomach, which we never had before. The fibre scopes that there used to be were just long, thin optical fibres, and they could break very easily. So if you had anything that was over about 1.5 meters, 7, which is nowhere near a horse's stomach, you couldn't see in. But it was certainly racehorses were the I suppose the initial problem, shall we say. They were the horses that were most prone to it, and certainly with the way they're treated, the way they trained, the way they fed in particular. As we'll come on to see with the rest of the talk, you'll see that it is not really very surprising that they are prone to this. But it isn't always just your race horses, competition horses, and although the percentages depend on which people you listen to, different people have done different studies, and certainly the racehorses, there's in a very high percentage, sometimes as many as 80% of racehorses will have some sort of stomach ulcer, and in various competition horses as well, it's been found to be at a similar level in some cases, often a little bit less, but even in I should just mention actually, this is a picture of, well, one of my members of staff, one of my receptionists on the right hand side, but on the left there's a lady called Hannah Eccles, who's a vaulting GB vaulting team and a Hoyes ambassador. She came to do a talk for us a few months ago, and if you ever have the opportunity to see her talk, she's absolutely brilliant. I'd never come across vaulting before, and it wasn't something that particularly interested me, but the way she talked about vaulting and preparing the horses, it goes all across the horsey disciplines, and I'd really recommend her. But like I say, it's not always competition horses, as in show jumpers, dressage horses, it's also show horses. We don't really always appreciate the stress that they go through in getting to a show, and the problems that they have with things like travelling, again, as we'll come on to talk. Even pleasure horses, it's actually been found in quite a high percentage of some pleasure horses, even the ones that are in the field, it can be as many as 50% sometimes that will have stomach ulcers. And again, we'll come on to talk about the various clinical signs. And one of those can be a normal horse, or apparently normal horse. They look okay, they ride okay, there's not always some obvious signs of it, and this is often something that people don't always appreciate. It depends on your horse as well, and you'll all have experience of different horses, different personalities. They all have different personalities, and some horses are quite stoical, quite tough. Other horses are wimps and, as we say up north, a bit marred. And it depends on whether your horse is that as to what clinical signs it will show. But one of the common ones, I don't know if I've missed one there, yeah, poor performance. That's a very common sign that we see. So this is a horse that's just knocking the last fence, it's not going properly, you're not happy with it, it's maybe, in the case of race horses, they may be not running quite as fast as you would expect. And that is a very common reason for horses presenting to us, and we always consider it if there is a problem with the horse's performance. And the resistance when riding or exercising, and that can be, obviously this is a very vague sign, so it can be in loads of different presentations. It can be the horse tosses its head, it might react badly to the bit, it can maybe hollow its back, things like girthing up can be a problem. And even the poor weight gain ones, the bad doers, the ones with the poor weight gain, even though they're getting quite a lot to eat, they're just not really showing that improvement that you would expect. And even as we progress through some of the signs, again, some horses can show very mild or recurrent colic signs. So they'll eat something and then start looking at the tummy, or they'll stop eating or start grinding the teeth, maybe start curling the top lip in that flamen response where they lift the nose up. And in some cases they can be quite severe. Generally not, it's generally more of a very low grade, a mild colic that you tend to see. And poor appetite, they may be just not eating, which I suppose goes along with the poor weight gain, the bad doers that we talked about. So they're sort of not eating very well, they maybe don't like the bucket feeds, maybe don't even eat hay particularly well. And again, one of the quite typical signs. But it can even be just behavioural changes. So you get a horse that is becoming quite aggressive. We've had that before, where a horse was extremely aggressive. As soon as you went near it, you even just grooming, the horse would turn around and bite and be really awkward. And it was actually, once we put the horse on treatment and the ulcers improved, we actually realised how unhappy that horse was. But it's not always about biting. It can be, like I said, about things like girthing up. The horse will just, you put the girth on and they start stamping the feet, swishing the tail, turning around. And I know that's you'll probably all sort of describe that with your horse. A lot of horses don't like that. It doesn't mean to say that every horse will have stomach ulcers, but it's just quite a typical sign that we see sometimes. But the most important thing is, first of all, like I've just been saying, a lot of these signs are very vague. I don't want to say that every horse that doesn't like its girth tacking up or is being a bit resistant when riding. There are other things. There's saddles. Make sure you check your saddles. I'm not here to talk about saddles and saddle fitting, but it is the most important. I cannot believe people ride with bad fitting saddles, and I would really suggest you get a proper qualified master saddler, someone who's done the qualifications, who's a proper saddle fitter. Don't just buy one online and think, oh, it's the right width, it's a medium or an extra wide or whatever, and it automatically fits. It isn't the case. Make sure you get somebody who's an expert in that field, because the saddle on the right, actually that's quite long. It's actually just sitting on the last rib, and it's subtleties like this that can cause your horse quite a lot of pain.
And I think you get the master saddler. Doesn't necessarily mean you have to have the expensive saddle, does it?
No, it doesn't.
It's the fit that's the important.
It is, and it may be that, good point, John, actually. One of my very good friends is a saddler, and I'm not just trying to drum up business for him, but he will go along and he'll check a saddle for somebody and say, yes, it fits, no, it doesn't fit. And you don't have to buy the saddle. It may be that it could just be a little bit of reflocking. In some cases it may just be a riser pad or something that's needed, but it is such an important thing. And if you think about it, you've got somebody who's, well, in my case, 90 kilograms sat on a horse's back, and all that pressure, and if that saddle doesn't fit properly, it's like us wearing a pair of shoes and then going running that are a bit too tight, or you get a blister. You know how uncomfortable it is. But yeah, good point, John. But other time, check the bit's all right. It could be that the horse is tossing its head in the air because the bit's too big, too small, too high, too tight, whatever. Maybe the horse just doesn't like the bit. We've had that with some of our horses where they just don't get on with a certain bit for some reason. It may be that they can get the tongue over it or something like that. So always check those things. And obviously the teeth, like we've just been saying about tossing the head. The bottom left-hand picture, you can just see some small wolf teeth. Not necessarily a problem, and I know people have different opinions on this. My opinion is get rid of them, because then you know they're not going to be a problem. But not everybody would agree, and I actually do agree, not every horse will have a problem with them, but I just like to get rid of them just as a precaution. But the top right-hand corner there, you can see the picture, the very sharp edges of those teeth, and they can actually see, you can see possibly just at the very back there's almost a yellowy brown line just in the gum, and that's where that's been rubbing against the horse's mouth. So you can imagine you're sat on that horse, and even if you're pulling quite gently on the mouth, on the bit, you will get quite a lot of pain associated with that, and that is quite a bad ulcer. Not the sort of ulcers that I intended to talk about, but it's certainly some sort of ulceration in the mouth. And again, rule it out. So this is the way we normally rule it out with dentistry. That's using a motorised rasp, and I think I would probably recommend that with most horses now. And then rule out the basics. The feet. Make sure the feet are good conformation. Make sure you've not got, like in the right-hand picture, laminitis. Harking back to yesterday's talk. Just make sure your horse is well shod. It's regularly shod. Make sure that the shoes are fitted. Make sure you pick the feet out. Basic things like that. And lameness, that's another thing. It could be that your horse is objecting, your horse is backing off in your hand because the horse is actually lame, and sometimes it's only when you see the horse on a lunge, which is not something everybody does. Certainly if you're just hacking your horse out, or maybe you're just schooling it to jump, or schooling it for a dressage test or a show, you're not necessarily going to put the horse on the lunge, and sometimes it's harder to feel some of the very subtle lamenesses. You don't always, or you can't always appreciate those when you're on the top. And also check for other sort of problems. Cushing's is a good example. These are things that can make your horse a little bit under the weather, a little bit quieter, maybe even change the behaviour as well. So again, maybe just look for other things apart from stomach ulcers. And then we may even do further investigations from these cases, and certainly some horses have come in with the owner's diagnosis actually that it's had something like a stomach ulcer problem, and well, the middle picture is actually a muscle biopsy. It was a horse that kept tying up and was having problems going forward because of muscle cramps, and even heart problems. We've seen that as well, where you get a heart problem. The scan on the right hand side is actually a horse's heart, so you can see the chambers of the heart there, and quite a good thing. Again, I'm not suggesting that everybody goes out and gets your horse scanned and x-rayed and blood sampled, but it's, again, just something to consider. So let's actually, sorry.
I can imagine, rather than going in, diving in head first, saying this is the problem, I suppose if you went in with that approach and that wasn't the underlying issue, that in itself could create more problems if you go to treat something that actually, that's not the issue, something else.
Yeah, well, you're right, it's the actual process. You're delaying the proper diagnosis of it, but also you're spending a lot of money and trying to get that. It's not cheap to scope a horse, but equally it's a lot more expensive to take multiple blood samples, do a heart scan, have well, I suppose things like the teeth and the shoeing is probably just a standard regular management of a horse, but certainly the investigation of other things is if it is negative, you've spent a lot of money on finding absolutely nothing. And in the same way, if you jump to the conclusion that your horse has got stomach ulcers, you may go down that line and sort of find absolutely nothing. So yeah, another good point, John. So moving on to the topic of the talk, I've finished waffling about other things now, so I'll talk about stomach ulcers or gastric ulcers. As a picture, the horse has got quite a different stomach to us. It's actually split into two separate parts. You've got the upper slightly whiter or lighter pink colour, that's called a squamous area, and it's a bit like our esophagus, our food pipe. That's not really got any glandular tissue to protect itself, whereas the bottom, the darker pink on the picture, that's very similar, in fact the same as our stomach. That's got glands in it which produce mucus, and they produce acid to protect that area. And this is where the problem comes. Certainly the acid seems to be the major problem in a horse's stomach, and particularly in the slightly lighter pink, the white bit I'll call it, where that acid sometimes gets pushed up onto this, or splashes up onto the sensitive area that's not protected by the mucus. You can also get ulcers very similar to humans, which are our duodenal or peptic ulcers that many of you will have come across or heard about. They are really the same as human ulcers in a lot of respects, in the site anyway that they found it. In humans there is this association with a bacteria called Helicobacter, which is treated quite a lot. We don't seem to find that in horses, although things are evolving, and like I say, it's a relatively recent condition, or a condition that we've recently been aware of, really. And there's quite a lot of research, and every year, or certainly every couple of years, they produce what's called a gastric ulcer consensus statement, where they basically collate all the information they've got and make a plan to go forward for treatment and for diagnosis. So we'll come on to different sorts of it in a minute, but the risk factors that are causing a lot of these problems, and really the reason I've gone through it this way is to show you what, well, now you know what the stomach's like, you'll realise now why stomach ulcers occur. So, like we've been talking about with the girth, as soon as you put that girth on, it pushes up the stomach, it increases the abdominal pressure, and that almost lifts the level of the liquid within the stomach, and then it then has a greater chance of splashing against the unprotected squamous area, the lighter pink area. And so obviously riding, particularly if they're riding, and again, we'll come on to talk about this, but the old BHS way was don't feed your horse before you exercise. Now that's probably gone out the window, and we're now saying actually it's probably a good idea to give them some sort of food or something to protect that acid, and maybe make a little bit of almost like a protective cap or a raft over the top of the fluid lining, so it reduces that splashing. And obviously when a horse is trotting, particularly when it's cantering, there's a lot of vertical movement of the horse, and therefore the stomach and the inertia of the gastric juice must splash up against the lining. So exercise is a common reason for it. Stress, this can be a big thing, and we get horses that are obvious stressors, horses that are very almost manic, really. They're walking around the stable, and they're the typical ones. But you also get the silent stressors, the horses that just seem to stand there flapping their lips or just staring into a corner, and equally they can be a problem. It can affect things like the secretion of the mucus in the stomach, and that can cause a lot of the problems. So again, causes an issue. Even boredom, horses that are bored, they will tend to develop other vices as well, and that can contribute to the ulcers. But as we'll come on to see, travelling is another thing. Really probably goes along with the stress in that it's an increased stress. There is a bit of vertical movement again, but it's really the stress of the travelling. And competition, again, these all contribute to that horse's stress feeling. But diet is a huge thing, and in a way it's a good thing that diet is, because it means there's something fairly straightforward we can sort out. We can do this in a very easy way. I'm not saying it's all about management, and sometimes you will need to give drugs to help prevent it, but actually it's good that we can manipulate the diet a little bit, and we'll come on to talk about what to do. But horses that generally have food going through the stomach generally don't get ulcers quite as badly. I'm not saying it stops them completely, because the way we keep horses, the fact that we do stable them, is an alien environment for them. So turning out to grass is the best thing for horses' stomachs. Certainly you get that gradual throughput of food in there, which helps provide the protective area, and also it stimulates the secretion of the mucus and helps protect that top lining to it. And also, again, talking about diet, it's all things like sugar against high fibre. Fibres, and there's actually, John was talking about the laminitis talk yesterday, and it seems to me that horses are, although they love sugar, like ourselves, actually sugar's not very good for horses on the whole. It can cause things like azoturia, laminitis, even encourages stomach ulcers. The reason it causes this is it ferments very well in the stomach, and you can get things like volatile fatty acids as a result of it, which then again add to the acidity in the stomach. Whereas fibre is very good for horses. That helps, and like we were saying about a protective coating, a protective cap, it helps stop that splashing up. And starvation, we've all talked about we were talking about yesterday about being careful with diet, limiting horses' diets, and I think we all know that if we gave horses food as much as they wanted, they'd probably end up all with laminitis, or certainly end up very overweight. So we often see this in the morning. They have an empty hay net, and so that does really increase the risk of that. The longer horses are starved, it massively increases. I'll show you a slide at what just a few hours of starvation can cause. Well, more than a few hours, a few days, and it shows how bad the stomach ulcers can get. So starvation is a really bad thing for horses. One of the problems we have for doing the gastroscope to look inside the stomach, we do have to starve the horses just before, but it's generally only for about 12 hours. If we don't starve them, the stomach's just full of food material, and we just can't see through it, and it is a real pain. Age, very, very problematical for young foals, actually, and I would say if you do have a foal and it has any sort of problem, that could be an orthopedic problem, it could be an illness, it could be anything else, I would strongly recommend that you treat preventatively for ulcers, because they are incredibly prone to ulcers, and it can be extremely serious. You can even get them perforating in the very young foals, particularly if they found things like bute, non-steroidal anti-inflammatory drugs. So but even without those, the stress of a young foal can, stress in a young foal can cause stomach ulcers. So this is me and one of my colleagues, Mike. We're doing a scoping on a horse. We've also got a video scope here as well, and this is a horse in our clinic where we're sticking the gastroscope up the horse's nose and then looking at it on a screen. It's a lot easier on a screen. We can see a lot more what we're doing rather than trying to look down a small scope. So we do prefer to do this all the time, and horses do tolerate it very well. We often give them a little bit of sedation just because it tends not to upset the horse that much. The worst bit actually is going up the horse's mouth. We put a gag on them as well, and the reason for that is that the scope can sometimes curl round and go into the back of the horse's mouth, and a scope doesn't last very long when a horse chews it, so we're always a little bit careful about that. So that's why we put a mouth gag on there.
Is this something that can be done at home as well?
Yes,
yourself?
The previous slide there, that's actually done on a yard, and actually the scope is pretty portable. It's just in a small unit, so and I think that's pretty standard for most vets, that they tend to be able to do it on the yard as well as seems to be going mad. It does tend to be done on the yard as well as in the clinic, but it is easier in the clinic. We've often got stocks available, and we have got stocks available in the clinic, whereas you don't always have that on the yard. The right-hand picture is actually looking inside at a horse's stomach. I'll show you better pictures of the horse's stomach, as I'm probably sure you've already realised. So we'll just go through these pictures systematically. So on the top left-hand side, you've got there, that's actually the esophagus, the food pipe. So as we're passing down there, we have to blow it up with a bit of air just to make sure that the scope can actually pass down, and we are reliant on the horse swallowing to do that. Sometimes it can almost get stuck in the folds of the esophagus, but that's a lovely looking esophagus. And horses tend not to get, because many of you be aware, horses don't vomit. Not like us or like dogs or cats, we vomit at the drop of a hat. Whereas horses have got a very strong stomach muscle, what's called cardiac sphincter. That's the sphincter that's next to the heart that leads into the stomach. So they don't really reflux up there very much. So they tend not to get ulcers in a horse's esophagus, which is different to humans. But on the middle picture on the top row there, that's a picture of what's called the margo plicatus, and this is the specialised line that occurs in a horse's stomach. And on the left-hand side, the lighter pink, the whitey sort of colour, that's the squamous that I was talking about. That's the area that doesn't produce any mucus. Whereas on the right-hand side, you can see the darker pink area, and that's the bit that is like our stomach. That's the glandular part of it. And there's even a little bit of froth in the bottom. That's the gastric juice, the stuff that the body produces quite naturally, because obviously anything that goes into our mouth, our stomach, it needs to be killed off, or certainly if there's bacteria in there, it needs to be killed off. The top right-hand picture, that's now looking back on itself. So the scope, you can just see that black thing that's in there, that is the gastroscope, and that's curling round on itself. So we're looking back towards that cardiac sphincter, that's the entrance to the stomach. And then you'll see that almost, well, in the picture, it's a vertical shelf of tissue. That again is the margo plicatus, and that's in an area called the lesser curvature, which is a very prone area, really, because there's very little gap. It's quite low down, and it's right next to where the stomach acid, the gastric juice, aligns itself. And then bottom left-hand picture, that's now looking towards the outflow to the stomach. That's then what's called a pylorus, and that's the area where that goes into the small intestine. The middle picture on the lower row, that is actually the pylorus. That's the entrance then into the small intestine. And you can see quite clearly this shelf of tissue on the right. It's not that obvious, but there is normally a lot of fluid around there. But we have to pump the stomach up, and that's a really important part of it. As we go in there, the stomach's quite deflated, so we pump it up to visualise things better. And it's very important we do remove that. At the end of every gastroscope, we always suck any air out. We don't want to cause colic. There haven't really been reports of colic as a result of blowing up the stomach, but obviously we remove it just to be on the safe side. You don't want to add to a problem, and it could just sort of reduce the motility in the stomach, so we're always a little bit careful. And again, the bottom right-hand picture, that's a very close-up image of the pylorus. Looks pretty okay. You can see there's a few folds. That's generally moving all the time. There's a lot of motility in there. It's going backwards and forwards, closing, opening. And sometimes it can be quite difficult to get there. We're actually looking, in some cases, we can look through into the duodenum, and that's quite interesting. You see the bit where the bile duct comes from the liver, and it's I always find it amazing that you can see that far into a horse's stomach.
It's quite fascinating. I'm just wondering that. So, from the start of the scoping, how long, obviously it depends on how far you've got to look, but normally how long would that take?
I think you're normally talking about anywhere between 10 and 15 minutes would be a standard scope. You've got to look at every area. Yeah, sometimes you have to, like I say, inflate the stomach, so that can take a little bit longer with some horses. If you do have some food material left, and unfortunately if you starve a horse, they will often eat the bedding, they'll eat their own poo, and you think you've got a clear stomach and you don't. It's full of things, so you do have to blow it up sometimes. Some horses, it seems to be quite difficult to get through into this pyloric region, and you actually often go underwater, so you end up going into the gastric juice and then coming out the other side, and that can be a little bit disorientated because all you see is these clouds, these bubbles everywhere. But you can often get through that. So yeah, I would say a standard scoping is probably only 10-15 minutes quite normally. A lot of the time it takes you longer to set up and get all the pictures ready than it does to scope. So what types of gastric ulcers? I know this might be quite dry and a bit bland, but there is an important distinction with the different ulcers. So what we'd said before, you've got these squamous ones. These are this is the equivalent of reflux esophagitis in humans, which is where acid reflux, as people talk about, where it comes back up into your esophagus or your food pipe. And that's the whiter area. And then we've got the glandular ones. These are more around the pylorus. And as I said, this is a bit like the peptic or the duodenal ulcers in humans. And it is very, very important to make a distinction, because these ulcers react very differently to treatment. And as I'll come on to say, there are different gradings of ulcers. And sometimes generally the squamous gastric ulcers are pretty straightforward. The worse they look, the worse the horse tends to react. Whereas for the glandular ones around the pylorus, you can have some really bad ulcers and a horse doesn't have particularly obvious signs, or you have some very mild ones with nothing else apparent, yet the horse is showing real problems with stomach ulcers. So there's a lot of work, a lot of research being done into this, and it's quite an exciting area, because there's a lot of progress. I'll come on to talk about the possible advances that we're going to hear about in the next few years. But the glandular part is definitely an area that's been looked into.
And of those different types, are they of the same severity, or is there a certain type that you might see when scoping and you might think, this is a bit more serious than the other one?
Yeah, I think obviously the grading system here, 0 to 4, and the very bad ones, the grade 4, they're often bleeding. They have almost frank blood coming out of them, and I think you'd look at those and think that must be painful, that it must be causing the horse some problem. And I think whatever sort you see, I would always be worried about a grade 4. Again, it comes down to what I said before about how stoical your horse is. If some of these seem to cope with them incredibly well, but you'd still be worried because of the potential risk. And okay, we don't really see stomach perforation in horses. It can occur, but it's generally associated with what are called gastric impactions, where the stomach just fills up with food material and doesn't pass through. But that's a really rare case, and nobody's really sure as to the cause. This is actually the squamous part, the equine squamous gastric disease. So that looks pretty normal. I think it's pretty obvious from that. It looks quite clear. You can see a few little dots on there. They're little bits of food material, little bits of fibre that may collect on there. That's quite normal, we expect that, and often what we'll do, we'll just have a syringe with some warm water and just to squirt through the biopsy channel, which can then flush those off, because sometimes you're looking and think, oh my god, it's got hundreds of ulcers, and then you just get your water, flush it off, and it's as clear as this. So you do have to be a little bit careful. So that's a grade 0. Grade 1, you can probably see again at the top of the picture, there's a few that I would actually think they're more bits of food material that are stuck there. Okay, they can sometimes be stuck to the ulcers, but I think that's what they are. You can see the liquid level actually just going obliquely on the right-hand lower side. That is actually the acid, the gastric juice. But you can just see around the bottom a few of these areas where, I don't know if my cursor works, you can see these little areas here, just sort of dark areas. Sometimes you see almost like a yellowing, often stripes really, almost like a tiger stripe up there, which is often where the acid splashed up, and particularly as the horse has been ridden or doing any sort of exercise. But again, areas of reddening, not too bad, not too deep. And then a grade 2, I think you can probably appreciate from this that there are areas now, these sort of areas, starting to look a little bit bigger and a little bit more yellow looking. These started to get a little bit deeper. There's a few more of them. This margoplicatus, I think you probably remember from the grade 0, was a nice straight line. It looked very clear, it wasn't serrated at all. And we're starting to get a little bit of irregularity here. We've even got a little round area there that I would be quite suspicious of is the start of an ulcer. So you know, quite a typical grade 2. And again, I think we can be pretty obvious that this is now getting a bit larger. It's a little bit redder, it's a little bit deeper, and there's a little bit more of it. It's a bit more extensive over the area. I suppose, quite surprisingly, the margoplicatus doesn't look as bad. Certainly in the other one, it looked a little bit more irregular, but certainly those are definite grade 3 ulcers there. And the same in the right-hand diagram. Again, that's a piece of food material. If it was an ulcer, I'd be pretty horrified by that. But yeah, this is definitely a piece of. Sorry, these are definitely grade 3 ulcers. And then grade 4. Again, you know what we said before, pretty obvious. The bottom picture there, you've got the bleeding there. This did actually have blood coming out of it. And then this top one, this is one I actually scoped quite recently, and I was quite worried by this, but I think it was almost like a dark red. It almost looked like a scab had formed over it. It probably had been there for quite a long time. You can actually again see some food material in there. The horse had obviously eaten a bit of its bed, but that is definitely the size of that is a pretty, you know, pretty awful really, and it's not surprising the horse was showing some quite bad signs. This is what I was saying earlier on about the starvation. This is what starvation can do. And okay, this is a very unusual situation. You don't normally starve a horse completely for that period of time, but this is how quickly these ulcers could develop, and it shows the risk of starvation on a horse really. So moving on to the glandular one, what we were saying before about this is the pylorus. This is this very movable area. Sometimes it can be quite difficult when you first look at it, and there's folds, and it could look good or bad actually, and it's often quite difficult to tell, so you've often got to watch it for a couple of minutes and see. So grade 0 again, intact, looks normal, looks pretty pink and healthy there, not red at all. And then it's just showing all these all together rather than going through individually. So you've got the grade 1 just starting to get a little bit red in places. You can see these little pot marks on there, but not too bad, only sort of the odd little area. A grade 2 now, it's becoming a bit more extensive. You can see in the bottom left-hand picture there's a few sort of quite sort of obvious ulcers. It doesn't look particularly healthy, it doesn't look nice. And then we started to get the grade 3 ones here. That one's there. It's almost bordering on a grade 4, that actually, because it's quite red. It's started to get a little bit of a scab on it, but you've got these areas, you know, a few little areas up here as well, which would be a little bit of a concern. And then a grade 4, that now looks pretty awful to me. It's very extensive. They can be worse than that, and actually in the top, at the top of that picture, the bottom right-hand picture, you can just see the top there. There's actually a a bit where there's a bit of what's called fibrin. That's when blood clots, and it has almost this little scab that fits there. So we actually picked that off, and there was a bit of blood underneath that. So moving on to treatment, and the treatment is really omeprazole. That's a drug I'm sure a lot of you will be aware of. If any of you have had ulcers yourself, it's the go-to thing. It is available now in a horse form. It is quite expensive. I think one of the problems is this was originally designed for racehorses. It was something that obviously racehorses, given the cost it is to train them, they can afford 20 odd quid for a tube of Gastrigard, which is not a lot for them. But the problem is you have to have them on it every day. There's different levels of dosage, and certainly the syringe is designed for about a 500 kilogram horse. But it has been shown in some cases just a quarter dose can often maintain the ulcers away. So you don't always have to give that big dose. It can be a little bit more cost effective. And it's what's called a proton pump inhibitor, proton pump inhibitor. And it's the protons that provide the acidity in the stomach. So it actually reduces the acidity and stops the stomach ulcers being caused by the acid. But one of the really, really important things with this is the time that you give it. Even though what I said before about making sure your horse has got food available all the time, the really odd thing about omeprazole is it's damaged by acidity. So it's actually better if it moves through and out of the stomach and into the small intestine as soon as possible. So ideally you give it on as empty a stomach as possible, so it's not got a lot of food that's going to hold it up. Some of them do have what's called buffers. They reduce the acidity. They're almost like an antacid to reduce the effect on the omeprazole and stop it being deactivated. But the problems we've had where horses are just not getting better with these, it's generally related to the timing, and it means you're just not stopping that acidity enough. So the second line there, 70 to 80% of the squamous ulcers will respond very, very well to this, whereas only about a quarter of the glandular ones will respond, and that's after about a month's treatment. So there are other things that we can do. Oops, that's gone too far. And this is things like sucralfate. This is a thing that helps the mucus, and it can actually plug the ulcers. Used particularly for the gastric ones. We tend to use that all the time for that. And it does quite a good job, really, and I do like it. It's a pretty safe drug. Whereas the misoprostol, which is actually, you've got to be really careful about it in pregnant mares, so I'm always a little bit wary about that. It does a very similar thing to the omeprazole. It reduces the secretion of acid, but it reduces the activity of the glands within the stomach lining. But I'm always a bit wary. There is, like I said, there's this association. It can cause abortion, or it has been used for causing abortion in humans, actually. So you've got to be really careful of using that. Supplements, like I said before, diet is a lot of this. Supplements, a lot cheaper than the drugs, and these are really what I would recommend. There's the Gastric Comfort, which is a Feedmark product. It's just one example of them, but there are lots of others, and they're just almost like an antacid, like I was saying before. The veterinary gastric supplement on the right-hand side, that's a slightly different thing. That's almost like these pectins. They almost fill up, almost expand. In fact, I had a bit of a panic last night. Actually, one of my dogs was he's been looked after by my sister-in-law, and I was called saying that she got bloated, and she's a Labrador. Bloat's quite a serious problem in dogs. It turns out, I think she broke into the tack room and ate a lot of this gastric supplement, and it swelled up in her belly and made her extremely uncomfortable. So I did have a lot of sympathy last night. I was really worried, but I have no sympathy. She caused it herself. But the way it works, as in the expansion, what it does is it causes this cap over the top of the stomach acid, which helps prevent that acid splashing up, and is a really good thing to give long term. As I said about Management, pasture turnout, try and get your horses out as much as possible. Okay, I know that's difficult. We were just talking about laminitis yesterday, and I know you don't want your horse to get too fat, and putting them out on rich pasture like that maybe isn't the best idea, but try and strip graze or reduce the amount of long grass available, or give them very long grass, which is maybe a bit more stalky, a bit more fibrous. That can often be better for them. Or like I said, limit the amount they get. But fibre is the key. Ideally molasses free, like I was saying about sugar. Sugar's not really good for stomach ulcers, so if you can try and reduce the sugar in the diet, that always helps. And fibre is a good thing. And even fat supplementation. Fat's been found to help as well. It almost protects the stomach ulcers, or provides a bit of a lining. It provides energy as well, so you're not having to give as much sugar, and it has been found to help quite a lot for stomach ulcers. As I said before, the old BHS way of making sure they weren't fed, maybe try and feed about an hour. Make sure you give them something. We give one of our horses ready grass just before we ride him, even up to half an hour before, again to try and produce this little protective covering. It can be used as well along with the gastric supplement, although sometimes horses can be a little bit picky about whether they take the supplements, so ready grass is just a bit easy to get them to eat. And maybe switching from very high sugar haylage onto a bit more low sugar hay, that will often cause a bit more protection against them. So as I said before, what's the future? Well, there's quite a few things. There's an injectable omeprazole if you're struggling to get them to be able to put it into the mouth. And like I said, ideally you don't give say Gastrogard with food, because it will be deactivated a little bit by the acid. So maybe injectable omeprazole is a good thing. Or this esomeprazole, it's actually a drug that's being developed at the moment. It's found to be about 4 times more potent than just straightforward omeprazole. It's longer acting, so we maybe have a longer half-life. It has a better effect, and acid suppression is the key to preventing stomach ulcers. But it's only just in the development stage, so the studies that prove how good it is are sort of not the most reliable at the moment. As I said, in humans, the Helicobacter, there hasn't been found an association with this bacteria, but maybe there is something else there that we're not aware of, and that might be another thing. So take-home messages: scoping is the only accurate diagnosis. I know there's the fecal blood test, and I think somebody was probably going to ask me about that, but it is okay. I'm not saying it's a lot of rubbish. It's just you don't know what grade the ulcers are. You don't know if they're even there. You don't know where the blood's coming from. It could be from the hindgut. Horses can get hindgut ulcers as well as gastric ulcers, so you've got to be a little bit careful of it. And as far as I'm aware, there isn't really any very good proof that it works. I'm not saying it doesn't work. I think it's just got to be developed a lot more before we can really guarantee. Omeprazole is the drug of choice, for the moment anyway, but the management is the key. If you can manage your horse, again, you'll reduce the risk of your horses getting stomach ulcers to a very low level. As I said, if you have to feed it, give it on an empty stomach, and if they're not getting better, it means you're not reducing the acidity enough. If you want any more information on stomach ulcers, follow our Facebook or website.
Well, thank you, Simon. I think it really has opened my eyes. I don't know about you. It's something that I have heard about, and now finding out those finer details, it really has opened my eyes to gastric ulcers. Very much like the laminitis talk that you did yesterday. I know you were saying there that feeding really is an important part. We've got the guys from Top Spec up here a little later on as well. They're here at 4 o'clock. They've got their equine nutritionalist. So I'm sure anyone that's been watching that wants to look into the feeding side of it further, that will be fantastic.
It is a big thing, and I know we feed ours. There's various things like Relieve is just one of them, and maybe I shouldn't say that with Top Spec here because that's not theirs, but there's lots of different ones. There's other brands than Denji of molasses-free, high fibre cubes and things like that. Or high fibre stuff, chop or chaff or whatever. But yeah, you're right. I'd certainly recommend that.